Hello, good morning, good afternoon, depending on where you're joining us from. I hope that music maybe gave you a little bit of energy for today's session. But you're very welcome to our Startup Global Industry Roundtable, Healthcare and Health Tech Businesses. I'm Isabel Nolan, Director of Programs at Startup Canada. To begin, I would like to acknowledge the land on which I'm on today, which is located on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, also known as Vancouver. And as we're a national organization, I would also like to acknowledge with respect the diverse histories and cultures of all Indigenous peoples. And I encourage you to take a moment to acknowledge the traditional territory you're residing on today. So today's session is being recorded and we'll add it to our YouTube channel afterwards as a living resource. And we'll make it accessible through our resource guide along with any other resources that we share during today's session. And we welcome you to connect with each other in the chat. Make sure you're sending messages to everyone in the room by sending meeting group chat setting. So Startup Canada, if you're not familiar with us, we are a national nonprofit that's a gateway to Canada's entrepreneurial ecosystem. We're here to connect entrepreneurs with support, community, and tools they need to build a successful business in Canada. Startup Global is one of Startup Canada's flagship programs that supports entrepreneurs looking to export and expand their business internationally. From webinars, roundtables like today's, and our annual pitch competition, this free program will help you build an international market entry strategy and plan. So these industry roundtables, what we're really trying to do is provide attendees with a deeper understanding of trends and best practices within their sector and leave with some actionable takeaways and resources that they can implement into their business. All of this definitely wouldn't be able to happen if it wasn't for our incredible partners. So I would like to take a moment to thank our co-presenting partners, UPS and Export Development Canada, as well as our program partner, TD, our ecosystem partner, Forum for International Trade Training, also known as FIT, and our community partners, GS1 Canada, Communitech, and WeBC. We're actually joined today by two of our partners who will each sort of share some words and some opening remarks. So first, I'd love to pass it over to Felipe, who's the marketing manager of small business at UPS Canada. Over to you, Felipe.
Thank you, Isabel. Good afternoon. Before starting with my opening remarks, I would like to take a moment to acknowledge the land on which I'm joining this webinar from today. I'm located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Wendat peoples. This land is home to many diverse First Nations, Inuit, and Métis people. Toronto is covered by Treaty 13, which, with the Mississaugas of the Credit, we recognize and are grateful for the enduring presence of Indigenous peoples on this land and the knowledge they hold. As we come together for this webinar, let us reflect on the importance of truth and reconciliation and commit ourselves to ongoing learning and respectful collaboration. Hello, my name is Felipe Sarique. I'm the marketing manager of small business for UPS Canada. Thank you for having me today at the Healthcare and HealthTech Industry Roundtable. I'm glad to be here to kick off our session. I'm proud to say that we've had a long-standing partnership with Startup Canada. And over the years, we've provided significant supports to many small business owners through various practices and programs, including exporting bootcamps, on-site event consultations, mentorship programs, and the most recent Women's Exporters Program. As a leading healthcare logistics company, we understand that healthcare logistics is successful when planned around the people and patients it ultimately serves. Serving global healthcare needs a cornerstone for UPS. We always focus on the patient, not just the package, resulting in a 99.88% on-time performance rate for cold chain shipments. UPS Healthcare offers full end-to-end logistics support worldwide by focusing on 6 main areas: cold chain, clinical advanced therapies, labs and diagnostics, pharma, home care, and medical devices. We continuously invest in the latest technology, allowing us to be more agile than ever. By consistently focusing our efforts on innovation, we're always creating new services that best meet the needs of patients. We have recently launched the UPS Premier service, which allows 24/7 monitoring of time and temperature-sensitive packages. And our most recent Saturday delivery means patients can receive their packages 2 days earlier at no extra charge. We're also getting ready to launch, and we're excited for that, the UPS 2-hour delivery window and Follow My Delivery, where patients, nurses, technicians, and family members can visually see in real time the arrival of their package. We know that the healthcare supply chain can be complex. However, UPS continues to invest in technology and infrastructure to address those complexities by focusing on patients. Whether it's offering reliable shipping solutions, industry expertise, or a variety of advanced tools, we are dedicated to supporting Canadian entrepreneurs in helping their business grow. Remember that you are not alone. There is an ecosystem ready and willing to assist you in ensuring your success. Thank you, and I hope you all enjoyed today's session, and we look forward to collaborating with you soon. Thank you, Isabel, back to you.
Thank you so much, Felipe, for joining us and for opening us up. And if anyone has any follow-up questions for Felipe, I think he'll be staying on for a little bit. Otherwise, please get in contact with us and we can pass you on to the appropriate person. Now, I'd love to pass it over to Helen. They're an account manager for small business at TD Bank. Helen, hello, you're very welcome. I'll pass it over to you.
Hi, good day, everyone. I hope everyone is having a good morning or good noon. My name is Helen Penn. I am a small business account manager at TD. I am also a woman enterprise banker. And then thank you so much for the opportunity, for having me being here with many passionate, driven, and visionary people. And at TD, we believe supporting entrepreneurs isn't just about business. It is about building a stronger, more inclusive communities. We're proud to stand behind a woman or man who are reshaping industry, launching innovation ventures, and pushing boundaries every single day. Sorry, there is a fire truck outside. Not sure if you guys can hear me, but in my role, I do have the privilege of working with diverse range of business owners and professionals, from accountant, doctors, lawyer, digital first founder, online or retail business owners. I see the firsthand resilience and creativity it takes to balance the demand of running a business while staying true to your vision. Whether it's helping a client to secure finance to expand their business, or to guide a new business owner through their first business plan. I'm consistently inspired by the courage and the adaptability and the leadership showing in all the business owner I'm seeing. In today's event, I think it's not just celebrating the spirit, it's also about a reminder no one can success alone. It is through collaboration, mentorship, and sharing our story that to create our real momentum. At TD, we are committed to continue doing this job, but not just offering financial solution, also by listening, learning, and then to advocating for the success for a Canadian business that across all sectors. And then thank you so much for having me today. And I'm very looking forward to for all the great conversations today.
Wonderful. Thank you so much as well for joining us today, Helen. And again, if anyone has any follow-up questions for Helen around TD banking or the Women's Enterprise as well, please do reach out to her. Alrighty, so I saw we had a few more people joining us as our partners were doing their opening remarks. So hello, welcome everyone. This again is the Healthcare and HealthTech Business Industry Roundtable for the Startup Global program. So I wanted to share sort of what you can expect for the next two or so hours. So as you can see, we're going to start off with some speed introductions from you, our attendees. And you can either do this by being on camera or in the chat. So next we'll hear from two expert talks from our two guest speakers, and then followed by a panel discussion and Q&A with those two speakers as well. And this is when you can bring your questions to the forefront. We really encourage our attendees to ask questions, and we'll give you priority. We've got many questions that we've drafted out just so we can make sure we have a good flow to the conversation. But we're here to serve you and answer the questions that you have. So please don't be shy in asking any question. No big and no big or no small questions. And then the final section of today's session will be our networking breakout rooms, so that everyone will hopefully get a chance to meet a good amount of people. We'll put you into a room of about 2 to 3 other people for 10 minutes at a time. And this is really for you to have some intentional networking. Assuming everyone that's attending here today is working within this space. So get connected with each other. And hopefully you'll make some new connections and see where those conversations can go. We'll do about three rounds of those at about 10 minutes each. I guess we'll go straight into our expert talks. Let's not waste any time. So these expert talks, this is really to give you a sense of who each of these speakers are, where they sort of started from, and where they are today. Just when we're getting into our conversations, you really have a better sense of their background and who they are. So without further ado, I'm honored to introduce our speakers today. We have Latchmi, who is the CEO and founder of Maman Biomedical, and Sabina is the CEO of Nimble Science. So hello, welcome to Latchmi and Sabina. I'm thrilled to have you both here today, and I'm looking forward to digging deeper into your entrepreneurial journeys.
Thank you, Isabel. Would I be able to share?
Absolutely, yep. Let me just double check you have. Perfect. You should be able to share your screen now, Latchmi.
Perfect. Let me know when you see my screen.
Perfect. It's coming up now.
All right. So hi, everyone. I'm Dr. Latchmi Raghunanan, CEO and founder of Maman Biomedical. And a material scientist, PhD in material science, graduated in 2015 from Trent University in Peterborough. And then, I've worked in different industries for my career since graduation, in academia, in industry, as well as in startups. And in 2023, I left my startup career after 4 years and went straight for IVF treatments. Turning 40 and realizing that time was against me, and now I needed all help to start my own family. And so we did IVF treatments, my husband and I, for 1 year. But that's sort of where my journey for Maman started. My two worlds collided, as a patient and both as a material scientist. So for those of you not aware, during fertility treatment, you have to take, my treatment cycle required 20 injections in under 2 weeks. I hated taking these injections. I couldn't give myself these. And my husband had to give me these, and there were so many fights every night that we had to take these injections. Are you loading the drugs correctly? Are you injecting the right amount? You're going too slowly. You're going too quickly. Did you get all in? Did it leak out? Because a mistake with any single one of these injections can cost you that entire treatment cycle. These drugs are paid for out of pocket. Mine cost $10,000. That wasn't including the fee for the doctors. And over our journey, I've spoken to so many other women and so many other couples who share similar pain points. And it's one, nobody likes getting injections, but two, so many points of failures associated with taking a single injection that could result in cycle failure. And then three, each injection, because of the nature of these drugs, delivers over 2,000% times more hormones into the body than is clinically required for treatment efficacy. This has to do with deliver so much because the drugs are unstable. So for them to last a long time, that's just how much you have to deliver. And like I said, you get any one of these injections wrong and you can risk ruining that entire cycle. And as a material scientist working in this space, I said, why doesn't better exist? And after a year of bitching about it with my husband, I finally decided, let's start this. Let's do this ourselves. And so at Maman, we're developing needle-free technologies for drug delivery. We've got two technologies, what I call port and patch. Both are microneedle based. And port is our first to market product. It's a device only, class 2 regulated in Canada as well as the US. And it's going to serve as a strategic de-risking product for our flagship product patch. So the value proposition of port here is that it provides painless drug delivery, and it works with existing standard of care. So anything that's a current injectable, you replace that needle with our port, and you inject those just under the skin painlessly, and you get your standard treatments. Now, Patch is our flagship product, and Patch takes it several layers further. We eliminate completely the need to take these daily injections. We're going to take those fertility drugs, reformulate them, and put them into our bio-based proprietary formulations, these microneedle formulations, and so that they'll penetrate your skin, and once they do so, they'll dissolve to slowly release these drugs. We're also utilizing proprietary encapsulation technologies so that we can allow these drugs to release when we want, how we want, how much we want, tune in the drug release for each woman individually, and also replacing the need to return to the clinic for daily drug blood draws, something that we have to do because the doctors need to see how much hormone your hormone levels are. You need to keep your hormone levels above a minimum required threshold. And so we're introducing also real-time hormonal sensing tracking into our technologies that eliminates the need to return to the clinics for these blood draws. And that's just how much I wanted to share on what we do, what Maman does, and how I started my journey. And so, like I say, it's a collision of two worlds. I suppose a scientist, a doer in the lab, and building other technologies for other people, and then as a patient, that lived experience and finding a problem that I was really passionate about solving, and then bringing them together, because now it's not just that I thought a better solution should exist, it's I know a better solution can exist, and we're building that solution.
Incredible. Thank you so, Latchmi, and such revolutionary things that you're creating. And I know so many people would benefit greatly from these sorts of products, and also so much opportunity to branch into other subsectors of health as well with the products like this. So thank you so much for sharing, and I'm looking forward to learning more in our panel discussion. Alrighty.
Thank you. I see a question. Can I answer questions?
We'll keep the questions for the panel discussion. Sultana will make a note, and we can cover that in the panel discussion. But Funmi, great question. We'll definitely get to that. All right, Sabina, I'll pass it over to you to tell us your story.
Thank you, and thanks, Latchmi. I've got a 13-year-old son who is dying for your technology to be more widespread. He's constantly telling me about all the reasons why he shouldn't ever have to have a needle, and how there's got to be better alternatives. So I'm excited to tell you all about my journey. It's really one of following your gut, which, if you know a little bit about Nimble Science, of which I'm currently the CEO, it would be kind of a laughable irony that I'm now in GI Health. But it really started from the beginning when I tumbled forward with no real plan. I went into engineering. I have a mechanical engineering background that I went into because I could literally get a scholarship, and I thought, that's cool, I should do that, and I could get a computer, and so I that's why I did it. Then it was a lot of fun, and then I drew straight lines, so I thought obviously I should go into something that requires mechanical drawing, so I chose mechanical, and then tumbled through it with no real purpose, and it didn't really resonate with me, although I was good at the math. And so there you are, kind of solving problems related to HVAC, which seems crazy because who really cares about HVAC? And by chance, I got an internship in Biomedical in Europe, and that's when I really realized the love of what I see as the ultimate form of engineering, which is really to take most complex machine reverse engineer it, try to understand it, and then try to improve it while it's changing. And when you put that against HVAC, it's a no contest for where my love came. I did a PhD here in the University of Calgary, and then just sort of tumbled forward into a role at the tech transfer office where I got into my first company. And that's where I realized that the marriage of biomedical engineering and entrepreneurship was really what jazzed me. The first company was called Zephyr Sleep Technologies. It was a medical device in the field of sleep apnea to do better therapeutic guidance. And after 9 years of doing that, I was ready to sort of go out on my own and take a more of a leadership position as a more primary co-founder. And so I met my partner, and he showed me this device that he had literally made in his basement. And he had to be connected with, he was going through an incubator that needed him to be connected with someone who had experience and had done that. And so we were introduced, and I was then trapped because he showed me the most simple device. It was a piece of plastic, literally, had nothing. And I had just come through some extensive de novos through the FDA and, touching all elements of guidance documents. And he showed me this, and I thought, oh my gosh, with my eyes closed, in 6 months, I can wrap this up and get you on your way. And I really had no idea of the complexity of the device, because the device is an ingestible capsule that collects intestinal fluid from the deepest regions of our guts, which is the small intestine, which is where our whole body generally controls itself. It's where the majority of pharmacokinetics occur. It's where our body has its nutritional mechanisms and absorptions. It's where key diseases are centered, and it's literally a black box of information that we infer from indirect methods. And so while the device is simple, the complexity in what we were uncovering and achieving, and the different types of things that we could, different types of verticals we could move in, and the different types of impacts were very overwhelming. And so the two of us set to work on a business model that we felt would really move the company forward, but also really move the needle and GI health forward. And I'll show you just a quick video of the device working in screen share, just so you see what I'm talking about. Can you see my screen?
Yes, can see it well.
You guys are in the way for me sharing it, so I have to move you. Okay, so this is the capsule. You swallow it in the morning. It stays contained within your stomach, and then a simple pH change allows the outer shell to dissolve. It then transits into the ileum jejunum region, where it starts to imbibe water. It acts on a small latch, a mechanical closure, seals it, and so it transits through your gut with no contamination from the colonic and only pure small intestinal material. That's actually, but we've compared it to endoscopy, and it's actually of greater accuracy than the endoscopy, because we have contamination from the endoscopy and not a very rich DNA sample. And the data that it collects in the middle here is this metabolomic heat map. You can think of it as just a picture where you see a mirror image between what we get here representing metabolites from the small intestine versus the stool sample. So for every time you've heard the word gut microbiome, you've really seen or heard about a proxy that isn't that representative of actually what's happening in the core. And so as we set to work commercializing this and doing all of the FDA and elements that you need to do, we really had the door, companies knocking on our door. We were primarily geared as a clinical tool to deliver new clinical diagnostics in primarily functional GI disorders, recognizing the opportunity along the whole gut axis, of course. But what started happening was food and nutrition, biopharma, and pharma companies started to knock on our door looking for access to this device. And that's what started our global outreach with an extensive partnership and pilot program servicing companies around the world. And when you think about it, nutrition companies and pharma companies, they don't belong in any country. They're all, the clinical trials are being done around the world. Their staff is around the world. And so for us, it was never even something we thought about, the fact that we're a global company. It's just, that's how the industry is. And I think that's true across most medical applications, that there really are fewer. Of course, there's regulatory boundaries, but there are much fewer boundaries in terms of the way business is done and thought of when you're delivering B2B particularly. So yeah, that's how we got our start.
Fantastic. Thank you so much, Sabina. Such fascinating technology that you've created there. And see Funmi put in a great well, for both businesses, pioneering tech, these will revolutionize medicine. So incredible. Thank you so much for taking us through your journey and kind of where you started and kind of where you are today. To anyone that just joined, please feel free to introduce yourself in the chat. We're going to move into our panel discussions now with our speakers. As I mentioned, we've drafted quite a few questions for our speakers that we've prepped with them, really so we can ensure that there's a great flow to the conversation. But I want to give preference or priority, I suppose, to our attendees' questions. So, Funmi, you asked a question right after Latchmi's presentation. Let me just grab it here. Just so I'm getting it correct. So, Latchmi, Funmi is asking, is the Maman patch being used for vaccination delivery?
We do have intent to use it in other deliveries, not vaccine, because microneedle technology, there are vaccine solutions using microneedle technology is currently being researched, and many in clinical studies already. So Maman patch, we see we'll be competing in a very crowded space if we choose to go the vaccine route. So rather instead we're gonna be owners in hormones. So we're going to do fertility treatment, then we're going to expand into hormonal healthcare, anything hormonal healthcare, contraceptives, menopause, HRT, testosterone patches, all of those generally based on hormonal healthcare. We do appreciate that there's opportunities to license to other indications also, so we're going to pursue those. For example, we can license into diabetes. We can license to other persons interested in pursuing the vaccine technologies. And so there's lots of opportunity. But like I say, the hormonal health space has not seen a lot of innovation, and that's why we're starting there, along with my own why. But whereas the other bigger margin areas are vaccine technologies, and I can list a number of startups developing microneedle patches for vaccine drug delivery. So you will have a solution for vaccine delivery from other areas too.
Yeah, I just wanted to say, thank you for that, Latchmi, and thank you, Sabina. What amazing tech, and it's so good to have women at the forefront of it, I must say. Yeah, I mean, if that happens with vaccines, it will revolutionize things because then we can send people out in low and middle income countries that don't need to be medically trained, to get more comprehensive vaccination. So thank you so much.
Great question, Funmi. Thank you so much for asking that. And to the rest of our attendees as well, please don't be shy in asking your questions. This is why we're here today. I assume you come here today because there's something about your business that you need support with. So please don't be shy in putting your hand up and asking on camera, or you can ask via the chat or the Q&A box as well, and we'll get to your question. Latchmi, there is a question for you in the chat, but what I might do is if you're able to write a response to that, that would be great, unless you feel the story behind naming your business is worthy of sharing with everyone. Okay, I think she's typing it out. So I think it'd be great to kick off our discussion to talk about some key challenges that you faced at the beginning of your journey that perhaps were unexpected, that maybe some of today's attendees are either going through, or if they're still quite early in their stages, they haven't met those struggles yet. Sabina, can I ask you first in terms of any of those key challenges that you faced and how you overcame them?
Yeah, I mean, regulatory is often named as a challenge, but regulatory is really a process, and it's about finding people that have done it before, and good consultant or good people with experience. It's more art than science, and so that you want someone that has had, actual experience with it to really guide the decisions. Our challenge was, it was unexpected, therefore, because I kind of had been through that and know how to met that challenge previously. But when you're working outside the box, moving around the globe in different types of ways that are not sort of like, I have a widget, this widget's going to go to these people and I'm going to sell it like a traditional sort of medical device sale. And when you're working in this B2B R&D element, usually as pilot testing or as a research project prior to a commercial launch, which is a pretty typical actual pathway for a lot of med tech to get their start, but they start being used as a research tool prior to being used to deliver care to patients. It's actually surprising how few, maybe none, we were not able to find a regulatory person anywhere in the world that really could help us position it as an investigational use only device versus an investigational device on its path to being used in care, right? So when you're trying to get regulatory approval, you use it as an investigational device to gather evidence for an eventual approval. But we weren't doing that. We were using it as an investigational use only, a research tool, which still goes through regulatory, but it's not a very well known, and there are not regulatory experts that really know how to move you around the globe. So it's everything from like, hey, I want to do one in Brazil, I want to do one in Austria, I need one in Japan, and so we had to do that by just growing that expertise ourselves. And so we created a internal expertise at being able to read the regs, understand the process, develop these technical files. And now we can move very quickly around the world into just about every jurisdiction. And that becomes an asset that we're able to offer to our customers. And we've actually sort of packaged that into some of our product packages. So we turned a challenge into an actual bit of a fee for service, which is great, and it met our needs. But you can't underestimate how difficult that research use pathway is globally. Or sorry, not how difficult it is. It's actually really simple, but how the expertise is not out there.
Mm-hmm. Interesting. And has it been a process you've had to go through each time you've gone into a different country or a different region, or is it sort of a one and done for?
Yeah, no. So the device gets approved as research use only. It gets approved for each study in which it's used. So
Okay.
every time a customer has a use for the product in their clinical studies to collect data to inform some research outcome, then we have to prepare a submission process alongside them. But we've just, developed it as a process, and it's now very it's simple. And we use this one technical file that meets all of the different requirements, and streamlined it, but it does need to get done every time.
Right. Okay. Thank you so much, Sabina. Latchmi, how about yourself? Any like one key challenge that you faced that was unexpected that maybe our attendees can learn from?
Yeah, so I'm a technical founder, and we're early stage. Maman is early stage. And what I find, and I still find this challenge, and very unexpected, is how much time is spent not building as you develop and grow your company. Managing communications, the admin tasks, the business development, um, and if it's sort of become a back of mind. I know I'm still we need to be moving the needle on our science, and even when I think, oh, I'm going to bring on technical experts and a team to help me build, and I'm thinking it's going to be easier because there's people who are going to be building, I'm realizing no, it's not easier. It's difficult. It's still difficult, and in another way. And so that's been unexpected for me. Because I myself have been that technical champion in previous startups. And so now being on the other side of the table as CEO was something totally surprising, because now what I envision as building a company was all building product, and I'm finding that that's maybe only 20% of the story.
Mm-hmm. Excellent. Thank you so much, Latchmi. We've got some really great questions coming in from our attendees, and keeping true to my word, I want to make sure that we're putting them to the forefront. Alrighty. Also, if there's anyone in attendance here today that you have a specific challenge you're working through as well, please do share. And either, you know, one of our speakers can give you advice, or maybe there's also someone in the room as well that has been through that and can offer you guidance. All right, so up first, FundMe, asking the question to both of our speakers: how did you attract financing at pre-seed to seed level? And maybe let's start with that question, but we can also maybe broaden it out to funding in general that you navigated. So Sabina, I'm gonna go to you first.
That's another global story. We had our first major funding outside of the US, outside of Canada, which was really helpful because it helped us gain some traction in Canada. And there's really, for this type of deep tech kind of exploratory type devices that are less sort of specific, you know, we are this, we're going to do that, that sort of linear thinking. It's really difficult to get funding in Canada. But the combination of the US and other international funders makes that a little bit easier. We did it through, we were part of the Creative Destruction Labs, which had some international mentors as part of it. And so those international mentors introduced us to people in the Bay Area, and we were fortunate to get a lead out of the Bay Area. And then they filled the round with a lot of their, funds that they were familiar with and that they thought would be good for us. And then that sort of created this international cap table that then gained interest from, we now have investment out of New Zealand, France, and Japan. And so we are a very internationally funded company. I'm trying to get some Canadian funds now because I'd like to balance out my cap table and build some better ties here with Canada. But it does allow us, when we're moving globally with different customers, it does give us credibility of, you know, that we have a European funder and that we have an Asian funder and things like that. That does help with some of the customer acceptance of what we're doing in those countries.
Brilliant. And so you haven't, like, even in terms of grants, you haven't received any sort of Canadian funding?
Oh yeah, no, sorry. Yeah, we are well supported by Canada. Canada's great at grants. It's incredible. And I do consider that funding, but it's a different type of funding, obviously, with yes, but we do. IRAP has been very generous. Alberta Innovates, my tax funding, the SHRED program is absolutely incredible. Every time we sit with our board, which is primarily US based, they're just like, sorry, what happened? You did what? And you got, we are very fortunate here with our non-dilutive funds across Canada in the medical space, I think, for sure.
Mm-hmm. Absolutely, thank you. And if anyone has specific questions on grants, maybe we can revisit that topic as well, Sabina. Latchmi, same question to you in regards to how you attracted financing at that pre-seed to seed level.
So we're currently at the pre-seed stage and currently fundraising. And a lot of the feedback that we're getting, while everybody loves our tech, is that we're too early. This is the feedback we get in Canada, whilst from US interest, we're getting, our feedback is, why are you raising so little? So it's two very different dynamics we're having. We're navigating whether or not, so we're looking, having the US conversations. We would like to be, our first monies to come from Canada. But at the stage that we're at, it's angel investments that we're looking for, the angel groups, the angel syndicates, because we're also too early for VC money. In terms of grant funding, also, we know that there are opportunities, but it's very gated. And so we filed our first shred this year, so that's good. We haven't been able to unlock IRAP funding yet, and that's simply based on, in Ontario, the market is the industry is so saturated that there's huge gateways, I should say, to get in. And so, IRAP has asked us, when you have 500,000 in the bank, then come back to us. And so it's sort of like, for truly early stage companies like us, we're struggling to make it through because a lot of the programs are meant to support you sort of in that middle stage once you've got that co-matching funds and money to demonstrate that you can be a long-term sustainable company. So we're, you know, still knocking on every door and trying every avenue, but yeah.
It's a process, isn't it?
Yeah, it's a process. Yeah, and I see, yeah, I very unhelpful. And even now, there's even more challenges because we used to have IP funding from both IPON and Elevate IP in Ontario, but with new changes since the last funding rounds and elections, even those have we've gone back to no funding. So they've reassessed us and say, well, you're too early. Unlock some more milestones before we give you back more money. And so that's why it's at, and it's like every time you think you've pounded down on some doors, there goes another one pops up. And that's really what it's like now. I would say it's not like this for everyone, because we're not a university spin out. That's where we're facing a lot of these barriers. On the other hand, for young entrepreneurs, there's lots and lots of support. The university networks do provide that support and allows a whole lot of that de-risking to occur at the universities before you actually launch your company. It's because we're mature founders, with our idea started not out of a university lab, but from our own lived experience, that why we're hearing that we're too early is we're doing that de-risking that usually happens during a postdoc fellow work.
Interesting.
I think what I'd like to add a
Yeah.
little bit of my so that caused me to reflect, like where and why have we been successful. There's the Alberta piece fits a little bit into that. It's a small pond and it's easier to be a noticeable fish within it than within Ontario for sure. So that's definitely part of it. But I think it was a lesson I learned from regulatory. So in my last company, I did a lot with the FDA. And once I started to realize that these were well-intentioned, knowledgeable, very smart government employees, it really helped because they really, as well-intentioned and as smart as they are, and they are, they're working under a different type of, they're punching a clock and they're hitting a button and they're being judged on metrics, and there's more work than they could ever possibly do. And so everything that you do to help them make their job easier becomes something very valuable to you. And in the grants world, I think it's the same thing. The grant administrators are well-intentioned for the most part, very knowledgeable and motivated. But there's these realities of the way that they operate. And so all of the work that you do to put your name constantly, self-promote, be everywhere, be attached to things, be on, like, just create this presence that makes them feel like your company has mojo, speed, and credibility, even though it feels gross, because you're like, why do you think because I post every 2 days on LinkedIn that our company's doing well? But you hear it all the time. Oh, you guys are doing so well. I keep hearing about you. You're like, I post those myself, right? Like I literally make that up and I put it on the internet, but it helps them give this sense of momentum. And then that's where they want to put, it just makes the decision easier for where to put. So you just have to be the loudest, sort of prominent, name recognized fish, and then assign yourself with people that like incubators and things like that, where the pool gets narrowed down and they're looking at a subset of you. So just try to link into as many different ways to simplify the process for those grant, because it's not really about how great your tech is, because there's just no way for them to properly vet that. So they end up going with name recognition.
It's a great point, Sabina. And I've had speakers talk about like this is a topic that always comes up, right? And I've had speakers say that the relationship building starts 6 months to a year before you're actually looking for the
Or
funding.
3 years, yeah. Like IRAP.
Yeah.
I mean, we have a great IRAP project right now, but for years we talked to them and gave them update, and then we got $10,000 or $20,000, and we're just like, but then it years later, then it starts to like flow, and they have sort of they have knowledge of your company and they've watched you, they know you, right? And you're friends with them, and then it's easier.
Exactly. Yeah. And sorry, Latchmi, please go ahead.
I was gonna say I totally agree with Sabina, and I think that's how we've survived the last almost 16 months now. From day one, I recognized that this was a barrier that we faced. This de-risking feedback that we always get, but I recognize, and so we've been building publicly. I've been visible. We go, put ourselves out there and engage in everything. Don't say no to any opportunities, and it really has helped our names get spoken in rooms that we're not even aware of. So I do agree the relationship building is a huge part of it, and from day one we have been intentional about that. So
Yeah, absolutely, and it's just one of those types of relationships that you really need to be building and nurturing when you're building your business. It's so funny. I hope that answers your question. I know you had another one in regards to financial advisors. So kind of, I guess it's sort of a follow-up from that from me. But if you'd like to ask the question yourself, you're more than welcome to.
Hi, Latchmi and Sabina. So yeah, I'm at the pre-seed to seed stage, but I'm a medic, so I'm really learning about business. It's a steep learning curve. So I've managed to attract lots of medical advisors through the education company, really powerful ones. But now I've been told I need to get some powerful financial advisors on my team to attract the funding that my company needs to move forward. How did you go about doing that? I mean, it sounds like obviously you're both now very much into business, but you come from engineering and scientific backgrounds. So yeah, how did you attract good financial advisors? And I don't mean because I've been told that, if you get some powerful financial, if I get some powerful financial advisors, that whoever's putting money into the company will have confidence that it's going to be managed in a way that they approve of. So yeah.
Great question. Let me, who would like to go first? Sabina, yeah.
Yeah, I can. I mean, I think so. What my first job after my PhD was in supporting founders coming out of the university and launching their companies. Those are very difficult. There's a lot of work you have to do to get them to realize what they're good at and not just not what they're good at, but not what they have time for, and that it really takes a balance between the two. And so it sounds like you're there, and I think you should look at it not from just what's going to tick an investor's box, but who do you need beside you so you can do what you need to do that you're really good at, and that who can take the part of the business that you're less good at right now and you might learn from and grow as you go, but right now your company needs to accelerate. So think of it from your needs, not what checks an investor's box, because the next investor will have a different box for you to check and whatever. And financial, I wouldn't say financial advisor, or like you need someone on your team. You need to be a two-person team. And the most fundable thing, so the reason why we got our first check from the Bay Area investor for 1.2 million was because we told a story about how my partner was the CEO. He had created the technology. We started working together, myself as the COO. Together, we recognized what role everybody needed to play. And I was moved into the CEO role, and he moved into the CTO role. And when they heard us having made that decision on our own for the purposes of the business, it was an automatic, like, okay, you've got your founder mentality in check. And so, make sure you do have your founder mentality in check, meaning like, it's not about you, it's about a business that you're trying to get off the ground, and what does that business need? And then you're just wanting to, incubators and places where people congregate. You want to be in there, and you want to just say, like, I'm looking for a co-founder here. I'm looking for someone with a complementary set of skills to really accelerate this. And then be picky. You're getting married to that person. But that's what you really need versus, I mean, you can find financial advisors everywhere, but what you really need is someone on your team that's like, it's the two of us, and that makes it very investable.
Thank you, Sabina. Latchmi, anything to add there?
No, I loved what Sabina said about finding advisors who complement what you need versus checking a box from an investor. Um, For us, how we found advisors, we're involved in a lot of the incubators and accelerators across Ontario. And that means we have access to, our network has grown tremendously. We're actively engaged in all of these programs, and that means that we can leverage these systems. It may not be somebody directly in one of these incubators, but someone will say, "Oh, you say to an advisor in this program, I'm looking for a financial expert," and they'll be able to make references and connect you. So those a friend of a friend of a friend connections has come a long way for us too.
Brilliant. Thank you so much, both. Yeah, again, great question for me. Brilliant. So we have another question from Tom, and it's really around how helpful was Canadian government body and the process, or perhaps other government entities that that you used in your journey of building your company. Any information that stands out, or share any information which stand out from the support ecosystem that we have in Canada.
Latchmi, why don't you go first so I can compliment what you say.
Yeah.
So my support system, and I share the challenges that we've been having. So my support system at our early stage has really been the incubators and accelerators, networking, putting ourselves out there, showing up and engaging, has really created opportunities where our names get spoken into rooms that we're not even present in. Opportunities present that we wouldn't otherwise be available to us. And in the meantime, it allows us, I say we're banging down on doors. These champions and allies help us bang on these doors too. So really, I'd say for us, that's been one of the best resource and supports that we've had. I think, as we fundraise and go to the next step of our journey and we become a more mature, less early stage company, then we'll be able to leverage more of the non-dilutive funding opportunities that Canada is so well known for.
Thanks, Latchmi. Sabina.
Yeah, I mean, incubators have been, being a second-time founder helps a lot because you know the ecosystem knows you. I had the unique experience of when I first started my first company in 2010 in Alberta, there was nothing. It was literally me and the other guy that were in this space. It felt like there was no ecosystem in Alberta for this. We're very, very, very limited. And so we had our head down for 9 years, really not looking at integrating into the ecosystem because we didn't even know it was sort of being built up beside us as we were kind of over there isolated. And so when I left and I started to look at what had been built, it was quite outstanding. And then I had to learn how to do it like a first-time founder, who's who, but having some background to your name, whether it comes, whether you're a medic or that counts a lot, or whether, sorry, a medical professional or a academic professional or some sort of credibility helps a lot, either through you or through an advisor or somebody that sort of can move through those circles a little easier. For us, I feel like it's almost the challenge has been how to manage that effectively. There's so many programs you can be in, and you could be on a webinar 24 hours a day and be in rooms 24 hours a day. And as Latchmi said, there's already not a lot of time to do the actual product development that you're there to build the company around. So I think it's about making sure that you are aware and stay networked and plugged in, because these things move fast, they link together, and you want to be part of that and be the first to know about things and be in the lead of what opportunities are available to you. But then you have to also manage your time to make sure that there's actually that program or that thing is at the right stage for what you need your company to know at that time. Like in 2019, we did the TAP program, and it was really great. It was beneficial. But looking back, I'm like, oh my God, maybe now we need the TAP program. Like it was just way too early, and your minutes count. And so just being really discerning with how you use your time within those ecosystems, and making sure that you're keeping it all about you and what you need, and not, you're not there to necessarily mentor other like do all that stuff with caution, I think, because your business needs a lot of you.
Yeah, that's great. It's a great point. And like you said, there's so many great resources these days. Like the ecosystem, the support ecosystem in Canada is vast, and it's, I suppose, finding out or figuring out what actually will be the most beneficial to you and your business, and selecting wisely for those needs. Further on from those sort of like government support, are there any other Canadian support that either of you leaned on, and maybe you still lean on, whether that's a networking group that you're a part of, or there's a support organization close by to you, or your chamber of commerce, anything further from that you've really found supportive in your journey? No, Sabina.
I don't think so. I mean, we get a lot of support from, like in the food and nutrition space, where we have a lot of our customers,
Yeah.
the different, I don't know what they are. I guess they're different global organizations that are looking to move different types of technology and product support. So, for example, next week we're going to Vancouver for Proata Americas, and that's an organization that has featured us a number of times in their newsletters, and has been a great resource for us, and has welcomed us into their community and helped spotlight our technology, and that we sort of form these communities within these different, I guess they're like, I think of them as conferences, but they're not. They're like communities, but around your product area. And those tend to be a little more international, which is, I guess, what we're here to talk about today. So moving outside of your community, I guess. So there's government, they're supporting your community for clear reasons. They're investors that are global. And then I think being part of global communities, and not your chamber of commerce locally, because it's just not what you're supposed to be doing right now. You don't have a responsibility to grow your local economy. That's their responsibility to support you to grow the local economy. Your responsibility is to connect with the world and sell to the world and grow your company. And so, ditch the local, I don't know, oh my goodness, I hope nobody's sponsoring this, but, think global in the communities that you connect with.
Yeah, that's a great piece of advice. Thank you. Latchmi, anything to add to that?
I have leveraged my incubator support through all of these incubators programs. We meet incredible startups and other founders, and they have themselves been incredible support tools. Individuals who've done it already, been there, done that, that we learn from. You can reach out to anytime. Those have been great, great supports. To that, yeah, for us, it's been a lot, even, and so it's also international, because we have been involved in some US accelerator programs already too. So it's not only startups in Canada. Our network is growing, and we're leveraging that wholly.
Brilliant. And so I guess focusing on being global and getting into different markets, I'm curious to know how each of you identified like what markets you were going to go into. Sabina, I know you talked about as your B2B, and you have various different partnerships. Is that how you determined where you were going to go, just through these partnerships that you were creating?
Yeah, I mean, it wasn't much more sophisticated than the way I chose mechanical by, I could draw a straight line. So it's like, obviously I should do that. But I mean, we were looking for use cases. We are like specifically a hammer looking for nails, and we're lucky in that there's a lot of interesting nails, but that is our technology is. And so when the doorbell rang, from food, nutrition, biopharma companies looking for this, then we we serviced them not only for, I mean, we earned data from it, which is what we really needed. We earned some revenue from it, but we also earned experience and credibility. And so we just sort of went with that. And then now we're having to sort of take a step back and really evaluate like what is the value of this versus other opportunities. And so we just kind of ran with it at first because it met these first three needs and we didn't really overthink it. And it led to a lot of understanding of different applications, and it really led the company into a whole other direction. So didn't overthink it. Maybe, I'm not sure if that, we'll have to tune in 5 years to tell you if that was right or wrong, but that's probably the way I operate. Just do it and then learn from it and then adjust.
Well, I mean, it sounds like you just followed the noise and where the needs were, and then from your learnings from that, it sounds like you're now starting to build a strategy based on
a little bit more pointed and focused on.
I mean, it's I guess there's no one pathway to exporting and finding out, you know, some people are, they're like, yeah, I want to go straight to like the west coast of the US, or I want to go straight to the Netherlands. But yeah, for other people it's kind of I guess throwing spaghetti on the wall and seeing what sticks and then kind of going from there. Latchmi, how about yourself? You know, when you're determining your target markets and where you want to be getting your product to, what were some of the elements that help you decide that, and then doing that research into those markets?
So it started with the research. You know, we're self-and within the fertility space, and so as we did with our research, big questions, top of mind questions, well, where are the biggest markets? And so we identified those. Which regions were spending the most money on fertility treatments, which regions, and that's not necessarily the same as which regions had the most fertility patients. And so we identified North America as the largest market, but it actually has fewer patients than the rest of the world. And it's because medications cost more in North America than they do around the world. And so that's how we selected the basis for our go-to-market. And so we're going to be a global company too. We're starting with North America because it's closest to home.
No, absolutely. And I mean, you know, even going into the States, like you are bringing it to a new market. We often joke that the States is, you know, it isn't one market. It is at least 50 different ones. You have such a variety of diversities and customers in just in the US alone. I'm curious to know, because Sabina, I know you talked about the TAP program. Latchmi, you were you actually went through the World Trade Center, Toronto's TAP. Can you share a bit about your experience and maybe how that's benefited your like your goals of going global?
Certainly. We knew that going, you know, FDA is a big entry thing we need to comply with to even be into these markets. So we knew that going in, but what I didn't expect and what were the what came out of the TAP program, and I say here this is exactly Tom's comment and your comment is about that. Yes, you know, all these different states, it's singular. It's not a one size fits all, and that's what really stood out to us from the TAP program. I was really naive going into that, thinking, oh, we have a market entry plan for the US, but no, and a market entry, you know, it's may not be worth it for us to go into Arizona, whereas Boston is the health, or even though Boston is known as the health ecosystem, well known for healthcare, IVF isn't biggest in Boston. What's the biggest state, right? And it's New York. And so it's all of these considerations. It's what are we selling? Who's buying? Where are they? So really paying attention. That's it. The TAP program helped us to really focus in into this commercialization plan.
And also, my assumption anyway is that with your patch product, I know that primarily you've focused that around having to eliminate needles altogether. But was it also in the back of your mind thinking this would be a lot more deployable in other countries where maybe it's maybe not as popular for IVF, or yeah, like what was your thinking in terms of like the potential of the patch?
So we know there's huge opportunities outside of fertility care too, and even how we change. We're considering and still doing the pros and cons for other markets outside of US. So for example, Australia, we have to do clinical studies. Australia is a great market to do clinical studies, and Australia also happens to be one of the top IVF countries. Similarly, Spain, one of the biggest IVF players. Barbados, another big fertility industry. And so we're looking at these non-US based countries where we can get regulatory clearance for cheaper, and find early adopter clinics. So these are the markets that we're also exploring. They won't maybe be the most lucrative because they're big in terms of sizes, but not dollar value. The US is still the biggest dollar value. So in the end, we'd still be coming back to the US. But we're looking at, they're great entry points, and we get to de-risk and validate our business model, and then come back and say we can scale this everywhere else.
Brilliant. Thank you so much for that. All right, we've got a question, and just to give our attendees a heads up, we've got about 10 more minutes of our panel discussion segment. So if you do have a question, please feel free to come on camera and ask it, or you can ask in the chat as you're already doing. But please make sure that any questions that you do have that's burning in your mind to ask it to our speakers. So Tom is asking, how do you find the market entry strategy? How do you find the market entry in US and other countries with a new product? And what's your best takeaway from accelerators enrollment in the US? Do either of you have experience in like US accelerators?
Not US. So far as we're looking at the Mayo Clinic. We chatted with them last year. And they do have an accelerator that they're engaged with us again for this year. So we're trying to get in there, and it'll be a huge validation for us. A space that they would be an early adopter clinic for us, and they're huge. And that would be our market entry point into the US. Completing clinical studies and publishing with the Mayo Clinic, those big names on publications establish our credibility. And in the fertility space, that I think is what we're looking for, to really, word of mouth will go a long way, because you find in the fertility space, doctors are either very risk averse or very forward thinking. There's no in between. And so the early adopter ones would be the forward thinking ones who are willing to say, yes, we're going to try this brand new technology. And then we need their validation to convince the really risk averse doctors to adopt this technology. And our entire strategy is based upon knowing that these are the personalities, these are who our customers are.
Yeah, absolutely. And I feel like what both yourself and Sabina have said a few times is working within this space, you really have to work hard on building your credibility and working with the right people, having the right people either on your team or in your network to further your credibility and kind of anchor what you're doing in the right position. Sabina, anything to add there to Tom's question?
Yeah, incubators we did the Google Accelerator, which had a North American cross cohort, which was nice, and we spent a lot of time in the US, and it gets you familiar. I find that you need feet on the ground and just get over into like I went to China years ago, and it was just like once I walked around China, it was like, oh, it's just China. Like it's just a land with sidewalks, and it sort of demystifies it. So sometimes we're like, oh, like Australia, and maybe you go there and you're like, oh, right. It's just like you sort of demystifies it. So I think using incubators to be on the ground in places and just make connections to sort of demystify it for you is helpful. But I think one of the most powerful market entry strategies is KOLs. You just need to find the people that in that jurisdiction, they set the rules, and you need to get them on your team And then that provides you with a lot of market access points, particularly like when physicians start using your product. It helps everything from the FDA pathway, because FDA is risk benefit. And if they understand that there's a benefit and so says that, even better if you get a KOL that serves on an FDA panel, that's like an easy street, because it's like they've already vetted that person's knowledge and experience in the space. And if they say that they need this thing, then the risks automatically get weighed against that. So I can't say enough about KOLs for market entry, market penetration, first pilot studies, data collection in the area. It's a really powerful way, particularly in the US. They just work that way. They literally march to the dime of the KOL. Even the CPT codes and reimbursement, it all is like on, Dr. So-and-so says so.
Interesting. Great takeaway. Thank you so much, Tom. That was a really great question. Thank you. So I guess as closing out questions, and again, if you have a question, please do make sure you put it into the chat, or if you want to save it for the networking breakout rooms as well. We're absolutely comfortable with that. So you've both spoken about coming from those scientific backgrounds, and so the skills that were required to build these products and to get it ready for market. But beyond those technical aspects, what are some of the soft skills or leadership qualities that have been most critical for you when you've been growing your business globally? Sabina, can I go to you first?
Soft skills. I don't know. Understanding the cultural elements can't be overlooked. I think understanding what different cultures need in terms of the type of arrangements. And then I think, being able to be casual and fearless in the way that you present yourself. Like, of course, we're a global company, even though you don't have really much to that name. Like, I think just not underselling yourself and recognizing that it doesn't, the bar to be global, especially in medtech where you're talking about, and remember, I'm in a unique experience here talking about research use in these different, it's another thing to enter, much more planned event to get into, but forming champions in that country and friendships and networking in there and being able, because they'll start telling you about who to call and, oh, you should be talking to this person and you should talk to that person. So just the networking.
Brilliant. Thank you. And Latchmi. Latchmi, oh, sorry.
Can you remind me of the question again, Isabel?
Absolutely. So beyond the technical skills that you needed, soft skills or leadership skills that you found critical in building your business?
Strangely, I have found, so on the leadership side, and as we're growing our team, I have found that I have been to, I don't know if it's the right place to say this. So I've been really naive, I think, in promoting, giving people opportunities and expecting the best. It's a balance and wanting to do the best to people. I think I had to learn, what I'm saying is I had to learn the difference between being a middle manager, the leadership responsibilities of a middle manager, versus balancing that with the responsibilities of being a CEO. And for a long time I struggled with that, with my employees and leadership and coaching. It's my responsibility to make them better people, to train them. If they're failing, it's because I'm failing as a leader. And for a long time that's the way I handled it. But as a CEO, my company was suffering. And so then eventually there came to a point where my first priority is to grow my business. And you find that balance in a very young company like ours. I realized that I needed to be hiring people who would take the workload off my plate and not be added to it. So maybe I'm not at the stage where I should be hiring young people who needed training, but rather experienced people who can take the work and run with it. And now that's counterintuitive for a startup with no funding, trying to leverage, because now all of the opportunities we're getting are from volunteers or interns who are young and inexperienced and need this training and coaching. So it's really balancing and marrying both worlds that I've struggled with for a long time.
Oh my goodness, Latchmi, you like just drilled. I just literally came to a new level of this just this morning. I mean, this was my, if you look at my page today, it's like, I'm done. I'm not here to nurture, grow. That's not the company we are. I can't wait to get to be that company, but we just need people that know what they're doing and can drive forward and that takes, it's the same thing where I was like, you got to just, fake it till you make it. When you're talking to global companies, like, of course, we're going to deliver globally, and sort of get that into your confidence mojo. It's the same thing with that team development. You're like, of course, I'm going to hire this 25-year veteran who's grown, $1 billion sales team over there to do my little widget. Like, but that takes some confidence that you're ready and that you can deliver on that type of person. And I think a lot of startup founders, myself included, just it's so easy to rely on early, new grads, and there's so much funding for it. And it's so you just think, oh, great, I'm going to get 70% of this person funded. But yeah, I'm with you, Latchmi. Done with I want people to pull me and pull the company. And that's what companies need. We're not here to develop talent. It's a ridiculous ask on companies like us.
Need them to hit the ground running when they start with you.
Yeah. And ahead of us so that we're running towards them. And
Oh, great. Yeah. So with that, we are at time for our panel discussion, and we're going to move into our networking breakout rooms.